Hi, I'm Dr. Ivor Benjamin, Conference Co-Chair of the AHA-ACC Consensus Conference on Professionalism and Ethics, a consensus conference report.
I'm a past president of the American Heart Association. I'm also the director of the Cardiovascular Center at the Medical College of Wisconsin.
I'm joined today by Dr. Emelia Benjamin, who was a lead author of this paper and specific task force on diversity, equity, inclusion, and belonging. Dr. Benjamin is professor of medicine and epidemiology at Boston University Schools of Medicine and Public Health. So Dr. Benjamin, what guidance then does the task force recommend with respect to diversity, equity, inclusion, and belonging?
One of the things that we have to address is that the cardiology workforce does not look like the general population. That's incontrovertible. The portions of women, of Blacks, Hispanics, Indigenous peoples that are in cardiovascular health sciences and cardiovascular clinical care don't look like the US population. And what's disturbing is that really hasn't changed over the last decade. So what are the immediate goals? The immediate goals will start from the converse, which is we've got to eliminate structural racism and sexism. We must achieve a freedom from bias, discrimination, and harassment. But I want to focus on the positive aspects. We also need to ensure equity, inclusion, and belonging in order to drive diversity in our trainees, our workforce, and our leadership. Now, if you talk to trainees, residents who are making the rounds of cardiology interviews for fellowship, not infrequently, they are the only woman in the room. They are the only person of color in the room. They are talking to people who are on the faculty who don't look like them. And if we want to drive excellence, if we want to drive diversity, we've got to be thinking deeply about what are the structures that are keeping in place the fact that for many women and people of color, they're concerned about joining a workforce that does not look like them. How can we do better? Because we can do better, because both you and I are cardiologists. We have great faith in our cardiovascular colleagues. We know that they can and want to do better.